Hello, Ken. How are you doing?
Wonderful. Good to be with you again, Doctor.
And I'm Dr. Eric Westman. It's my great pleasure to have the one and only Dr. Ken Berry on, and thanks for taking the time.
Thank you for having me on. I don't think some of your listeners probably realize what an honor it is for me to be on your channel because you're one of the founders of the real scientifically based low carb movements. And I appreciate all the work that you've done and that you are continuing to do. And I don't think you get enough credit for that.
Well, thank you so much for the kind words. And I guess we kind of just stick to the old pre-biohacking, pre-keto, we call internet keto. And yeah, well, I studied basically what Dr. Atkins was being known for, was he was using in his clinic. And so our research team now, 25 years ago, started studying it. About the same time you started using low carb and keto in your practice. And it's been great to watch you evolve over time. And it was my great pleasure to be in Dixon, Tennessee, just not so long ago, and to meet your partner. I don't know if they're partners, but your people there. What a great conference and meeting. And I wonder I have some questions for you that we're going to ask you, but what's on your mind these days?
Well, just trying to improve the health of the whole world, no big deal. Trying to explore and explode and destroy the multiple myths out there, the misconceptions, the flat out lies that not only are told by the established medical community, often well-meaning, but yet lies nonetheless. But also increasingly here of late, I've been really focusing more on, because as you may know, the mainstream medical narrative has been severely bludgeoned. And I would opine that it is definitely wounded, if not mortally so, in many people's eyes. And so I'm also starting to focus more on the huge pervasive misconceptions and misleadings that are bandied about by internet influencers, because in many cases their social media reach is far wider and far deeper than the American Diabetes Association, right? And so what I'm trying to do is to help people understand that there's a very simple remedy to the vast majority, not all, but the vast majority of chronic medical conditions. There is a simple way to, at the very least, lessen the severity of the symptoms and decrease the frequency of the flare-ups, and to decrease the seemingly chronic progressive onslaught of all of the complications that come from these chronic medical conditions if you follow a very simple way of eating and a very simple way of living. You can erase so many risk factors, or at least, we all roll the dice every day when we put our feet on the floor. That's just shouldn't be common knowledge. No, none of us are going to live forever. We're all going to die of something, but nobody wants to die in their 40s or 50s or 60s. And definitely, and perhaps more importantly, nobody wants to be an invalid. Nobody wants to be in assisted living or a nursing home for 5, 10, 20, 30 years because of some complication of a chronic medical condition that could have been completely avoided had they known these very simple things that you and I both talk about it every day. And so just trying to dispel the myths in medicine, but also in pseudo-medicine or paramedicine, you might say, that like you don't need all those supplements. You don't need that high pH water. You don't need that ozone machine. You don't need any of that crap. You just need to eat real food and live a real life.
Well, and amen. And, but I have to say the response, it really is that simple, but people say it can't be that simple. And yet it is that simple. I mean, how can it be that doctors know so little about food and nutrition? How is this possible?
It's stunning if you look at it in its totality. And I think, well, first of all, doctors don't get much education in nutrition. I got half of a semester my second year of med school. Half the semester was dedicated to nutrition. So that was like a Tuesday and Thursday for half a semester. And then the other half was behavioral science, Tuesday, Thursday for half a semester. So you can see how important my medical school thought that nutrition were.
Let's talk about human health. What you put in your body as food can't affect that, can it?
Exactly. And so I tell people, if when it comes to the care and feeding of somebody who's got a third-degree burn over 50% of their body, or who's been in a rollover MVA and has just mangled their face and their entire face is wired together, and we have to feed them through an IV, we got great training. Absolutely. We got wonderful training as far as that goes.
Yes.
But when it comes to just the care and feeding of the average human walking the street, the little training that we got was atrocious. And so there's that excuse. And that, I think, that is partly a reason for doctors being awful nutrition advisors, but also I think it's partly excuse as well. Because the word doctor, if I'm not misinformed, kind of means teacher in Greek. And so anybody who's going to be a good teacher, which every doctor should aspire to be, by definition, you have to be a good student. And if you are indeed a student of human health, which I think every doctor should be or strive to be, then you should be a student. You should be curious about, well, I wonder, surely what you eat has to have some effect on your health. I mean, it would seem ridiculous to not think that, right? So let me read a little more into that. And here's this crazy Westman guy. He's affiliated with Robert Atkins, who we all know, his story. But I mean, this guy's he's at Raleigh-Durham. I mean, he can't be a complete kook. He's on the faculty there. So let me look into this. But it's like doctors have lost all of their curiosity. And I think a lot of just regular folks don't realize how much medicine has changed over the last few decades, for sure, but even in just since 2020. Medicine, I think that if you knew the right now, the rate of suicide in doctors, the rate of just burnout, I'm done with medicine. I'm literally going to go back to school to be an accountant because that's less boring. I'm going to just retire early. I hear this every day on Twitter. And it's almost as if doctors not only have really lost that curiosity muscle, but also at every turn, no one is encouraging doctors to be curious. The insurance companies, if they work for a company, that company has no desire for that doctor to be curious. They just want that doctor to get just as many continuing medical education credits as required to keep their license and to keep their affiliation. They could care less if that doctor's curious. And so I think that's a huge part of this. And we read
a couple of books influential to me. One was Dr. Atkins, of course, and I went and borrowed his sheet of paper that he used in his practice to do our studies down here at Duke. But he also wrote a book called Dr. Atkins' Health Revolution. In the 1980s, he wrote a book that showed all of these medical conditions that got better. And it was sort of the roadmap after the obesity and diabetes got better. I looked at this book and, well, heartburn was next. Check. Irritable bowel syndrome. We did studies, fatty liver. We did studies on all these things. And then you wrote this book, The Lies My Doctor Tells Me. And I've known you for some time, and there are times when I just can't say exactly what you're saying. Now, I might be thinking it, but because I still am in that academic world, I learned lots of things from your book and your point of view. Doctors have also been kind of snookered, though, by medications, wouldn't you say? By the pharma world and the choice of pill over lifestyle. And so I'm trying to remember, you got into this because of your own personal experience, I believe. Me, I saw a couple patients do this in front of me, and I may be the last doctor who was curious to actually track down how did this possibly help. But so tell me about your practice. And I have to say, I really highly value doctors who have the street credibility of being in a practice doing this. And tell me a little bit about your background in the clinical world.
Yeah, so I've been in uninterrupted practice for over 22 years now. And when I first went to medical school, I wanted to be a surgeon. And then I realized two facts. General surgery, pretty much all you're doing is, what they would say in surgery, guts and butts. And then also you had to get started at 4:30 in the morning. And I was like, yeah, I can't do that. So then I considered OBGYN until I found out that all women go into labor at 4:30 in the morning. Again, come on, and so I discovered family medicine. And I could do as many procedures as I wanted, including scopes, including large tissue biopsies, dermatology, lots of procedures, colposcopy in the gynecology sphere. And so that's what I decided to do, because I could start at 8:30 in the morning, by George. And my practice, I had full intentions for a while to be an emergency room physician. I didn't want to have a clinic, but everybody kept saying, I really like you, doc. You ought to have a clinic. And so I thought I would start a part-time clinic. And while I worked in the ER, it wound up being full-time for the next 20 years until the clinic fire. And now I have a small part-time practice where I take care of about 200 old patients and patients I've had for decades. And because I'm so busy kind of trying to educate the world, including doctors and dietitians. But I learned early on, when I became severely obese and pre-diabetic, perhaps my medical education about nutrition was not adequate. And so that's when I started reading outside of what many doctors would consider my scope of practice, right? And one of the books that was instrumental for me was a copy, a little paperback edition of Atkins Diet Revolution that I bought for 50 cents at a rummage sale. And I just thought, well, I'll read this. I don't know who the heck this guy is. And I still have that book. And so I'll put that in my archives one of these days. It's one of the foundational books. And so then that led me to primal and paleo and all these. And then I kept hearing about keto. And then when I looked into keto and started trying it, man, my prediabetes was gone, losing weight like crazy. Heartburn it used to be so severe, I took 2 Nexium every day. None of my patients got the Nexium samples. I got all those.
Yes.
Right?
Yeah.
And so it was 80% better on keto. I'm like, so every now and then I would take a Tums or a shot of apple cider vinegar, and that controlled what previously was barely controlled by taking 2 Nexium a day and having 2 red bricks under each head post of my bed. So I was sleeping inclined to try to keep the acid down. All these other things kept getting better. And so I started recommending it to my most severely obese patients, people who were literally on the schedule to have bariatric surgery. And they kept coming back to me with, oh yeah, I've lost 20, 30, 40, 50 pounds, whatever. But also my knee arthritis is so much better. Also my heartburn is so much better. Also my psoriasis, my eczema, just on and on and on and on. And initially, as a practicing physician, you think, yeah, they're, patients are silly sometimes. No telling what happened there. And so the first time I would hear that, I'd be like, nah. But then Dr. Westman, the 10th time,
Right.
and the 20th time, I'm like, well, maybe what physiology, what could possibly be explaining that knee osteoarthritis is getting better before they've lost enough weight to really change the biomechanics of this? And that's when I started thinking about the inflammation, and I started looking at the inflammatory markers, and lo and behold, there's research out there that shows that a low-carb diet does that. And I'm like, and so then I started recommending it to everybody who was on the schedule to have a knee replacement or a hip replacement or a thumb joint replacement. I'm like, you should try this for 90 days before you have that surgery, because there are known potential complications of surgery. Why risk it if you could fix this with diet? Not everybody was interested, but some were, and enough got so much improvement, they called and canceled their surgery for joint replacement. And that's when and then I kept hearing about Carnivore, which, a lot of people think, oh, that's some weird other thing. It's really just a subset of keto. Keto is very low carb. Carnivore is just the lowest possible carbohydrate version of keto. And if you eat a high fat enough version of a carnivore diet, you're going to be in ketosis the majority of the day. That's been shown in hundreds, if not thousands, of anecdotal cases. I don't know if there's any research on that yet, but I bet there's some coming, because the fields of keto and carnivore are very popular right now among researchers. Last time I looked on clinicaltrials.gov, there was over 400 trials with keto in the title that have been registered or are ongoing right now or have just been completed and the research is not published yet. Over 400 trials, and it may even be more than that now. And I know there's several going on with Carnivore right now as well.
I think that's an important point to notice that these are very close in terms of teaching and foods. And even this is one reason why, because I've done low carb keto research, carnivore-ish, carnivore-like, reason why, it's not all that different. And yet the language and I'm not doing carnivore. Well, actually, you're pretty close. I mean, but I'm not doing keto. I mean, so I've learned to just counsel my patients to tell their doctor they're doing a Mediterranean diet or modified Mediterranean, and the doctor says, well, that's fine. But these are very close. And I even had someone kind of, argue that carnivore wasn't necessarily keto. Well, there's an internet version of keto where you're adding in oils and medium chain triglyceride, and you have to have special coffee and apple cider vinegar and all that. And that's not what we're talking about. But I think what you and I agree on as a foundation is that you eat real foods. You don't add in all these other really kind of keto junk products and junk foods. And so that's why I'm really intrigued. And also, being clinical myself, I've had some people who I couldn't fix with just a cup of vegetables a day. And they cut out that 1 cup of vegetables, they're fixed. I mean, and this could be the skin condition, it could be the gut condition. So how could that be? It's just a small change, doctor.
Yeah. And so when I first started being very interested in the ketogenic way of eating, I thought that it was all about the carbohydrates. And I think for the vast majority of people who are overweight, obese, or who have prediabetes, type 2 diabetes, fatty liver, hypertension, metabolic syndrome, I think that is a huge part of this. You've got to get the carbohydrates down very, very low. But the more I read about it, and especially the more I looked into the inflammatory markers, and a good friend of mine, Dr. Chafee, I'm sure you've heard of him, he says plants are trying to kill you. And that is hyperbole, no doubt about that. But some of his points are valid. Any plant, even a plant that has been domesticated and crossbred by humans for thousands of years, still contains many what some people would call anti-nutrients, which some people would call phytochemicals. And I think you know this very well, but for your listeners, there is a normal distribution curve for every facet of human physiology. Every lab test, every biomarker that we can measure, there's a normal distribution curve. And so I think when it comes to phytochemicals or plant toxins, that normal distribution curve still applies. I think there are some people who can eat 20 pounds of cruciferous vegetables a day, and as long as they allow for the carbohydrates, they have no problems, no inflammation, no issues whatsoever. For the vast majority of people, they can have a serving or two of brassicas of some kind and no problem, nothing. No, they can't detect anything. But there is a subset of people who the anti-nutrients or the phytochemicals in some of these plants has a noticeable chemical reaction. And I'll give you an anecdotal example. Anisha and I were just in Alabama visiting my side of the family. And my dad and my grandmother are avid gardeners. They have a huge garden every year. And so we were down there and they had corn on the cob that they had raised. They had turnip greens that they had raised. And they also had brisket and Boston butt because I knew I was coming, right? And so Anisha and I both are she's ketovore, technically under 10 grams of carbs a day, but she's got to be very watchful of what carbohydrates, what plant she eats, because she has an autoimmune condition called Hashimoto's thyroiditis. Yeah. And if she eats the wrong vegetable, it'll flare up her numbers. Her TPO antibody and her TG antibody will start to elevate and she'll start to have symptoms. Whereas for me, it seems that it's just all about the carbs, doc. As long as I keep my carbs as close to zero as I can get them, my A1C is great, my fasting insulin is great, my waistline is not great, but I'm okay with it. But we both decided to have a serving of those turnip greens. And they were delicious. They were not non-GMO, They were organic. They literally, the only thing that they'd been added was dirt, water, sunshine, and chicken poop. That's what had grown these turnip greens. By our family, we knew these people, right? So we know there's no chemicals. There was no, big pharma, big food. There was none of that. It was just literally grown in the backyard. And within 2 hours of eating just a normal size serving of these turnip greens, Nisha was having muscle spasms and joint pains and just felt miserable. I had zero effects whatsoever. And she knew this, but she thought, well, I mean, I'll give it a try. Because, it also, Granny Berry, it hurts her feelings if you don't eat her turnip greens. So, there's that family thing as well. And Nisha wound up suffering for 2 days after eating these turnip greens, which by carb count were perfectly for keto or ketovore.
Yeah.
But for her, and she likes to talk about the N=1 experiment, although she can eat 30, 40 grams of carbs a day and she's fine. She doesn't fatten easily like I do. She didn't develop prediabetes like I do, but she's got to watch specific vegetables or they will absolutely cause inflammation. And you've met Nisha a couple of times. She's a no-nonsense person. She's not going to be talking foolishness on purpose. And she didn't even want to believe it herself. And finally she's like, it was those damn turnip greens. I know it. That's what it was. And sure enough, that's what it was.
Well, so I think it's an important separation. So low carb allows your body to burn fat. And you can get low carb, you can get keto, you can get carnivore to burn fat. But to be totally anti-inflammatory or even ketones themselves can have anti-inflammatory properties.
And I think for many people that the ketosis that comes from eating low carb enough masks the inflammation that they're having from whatever vegetables they're eating. And this, Doc, since I'm really going down this rabbit hole, I thought, well, I've got to know more about archaeology. I've got to know about diets of the past. I've got to know more about anthropology, paleoanthropology. And so what I've found very telling in the anthropological and archaeological record is that fermentation of both plants and of dairy have been around for a long damn time. I'm talking about 7,000, 8,000 years. That sure, people in Asia, they eat soy all the time, but until just a few decades ago, they virtually never ate soy unless it had been fermented, right? Many of the cultures that developed lactase persistence still fermented it because you can't forget about the casein in the whey. For many adults, that's very inflammatory, even if you have lactase persistence. And so what I currently think, I believe, and if anybody thinks that's an equivocal statement, it's not, because I think that's how everybody looking at some kind of scientific subject, that's the language you need to use. But to be honest, what I think that I currently believe is that all of us probably have some reaction to the phytochemicals in plants. And most of us, as an adult, have some level of reaction to the casein in the whey in dairy. And so if you're in a deep state of ketosis, those ketones are so therapeutic, they probably mask that to some degree. And more in others because of the normal distribution curve. Some people, it's just too severe of a reaction. And so I really think that a 90-day carnivore elimination diet, eliminating everything but meat and egg. Seafood, sure, it's fine. Include it if you want to, but nothing breaded, no vegetable seed oils, just in case, right? Just meat and eggs for 90 days. And then you can do these N=1 experiments of adding back in the turnip greens. I mean, turnip greens, how could that be a problem? For some people, I think it is, even if they're well cooked, because Granny Berry likes to cook hers to death. Nisha was definitely not eating these raw, and still, whether it was the oxalates or whatever, had a body-wide reaction that was inarguable.
Yeah, well, the use of this, especially if you're under medical supervision, I think this is a reasonable thing to do. And if you're watching this, you're wondering where to start or anything, you want to learn from someone who's been using it. There's a false expectation that the teacher has to be doing it, but there's just kind of an expectation that if you're a YouTube doctor influencer, you have to be eating that way. So, okay, we do eat this way, but that shouldn't have to be that way. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.